let's look, one last little area that I wanted to talk about is as urologists, what it is that we're able to do, and then what is it that we're not able to do, but we might have resources at our fingertips. What do we refer out to? So we know people who do work in sexual health, where it's men or women, we know that it's multifactorial and have like pelvic floor physical therapists at our fingertips, or sex therapists for the individual, sex therapists for the couple, so on and so forth. When is it appropriate then? Like, what situations do we need to be thinking about these other types of resources for our patients? Certainly, we've talked about the testosterone. That's something that we can do. Some of the other medications, those are things that we can do. But we can't really help with the more supratentorial components, right? I think we can talk to them a little bit about it, but if they need some counseling or therapy, you must have good sex therapists in your area. And do you have difficulty referring people to sex therapists because maybe the couple doesn't want to do it together? Maybe, I don't know, lots of things going on there.
A super good question. I always laugh because apparently the sex therapists tell me like people don't want to come and see them because the stereotype is that sex therapists watch you have sex and judge you.
Oh my.
That's not what sex therapists do at all. So it's a lack of understanding of what the role of a sex therapist is.
They did that in the
right?
70s with the Kinsey Report, but we don't do that anymore, right?
Yeah, totally. So pelvic floor physical therapy, any pain with sex, where any pain causes muscle tightness, muscles get tight to try to protect you. That's not always in our conscious understanding. So really seeing people to be like getting comfortable with touch that doesn't cause pain, learning how to relax, the role of the breath, all of those important things. I am not a physical therapist. I am not a sex therapist, and I don't want to be either one of those. So it's part of a team. And I tell patients that. I'm like, I'm a three-legged stool, right? I can do the medications. And I got into this. I wrote the book and started the podcast because I'm like, I can make your pelvis great. I can give you Viagra. I can give you vaginal estrogen. I can tell you to use lube. But if you have prejudices against sex is dirty, pleasure isn't for me, I don't want to touch myself, all those things, I can't, that's not my job. So it was kind of the learning more about sex to be like, this is not just hormones and a hole and a hard penis. This is complicated socio-cultural construct that we really can uncover and learn a lot. I mean, I recently saw a couple. She was coming in, pain with sex. They weren't communicating about it. I'm like, go read my book. Go see the physical therapist. Here's the vaginal. She comes back and she's like, we've been married for 45 years. We're having the best sex of our lives now. Thank you so much. She's like, we started talking about it. We communicate. We try new things. Like, it's okay to try things and fail, right? But like, I get the wins coming back. Like, I've saved marriages repeatedly, right? And I'd say to me, that is more satisfying than seeing if I can get a semi-erect penis 20% better. Oh, by the way, you can have sex without a erect penis because we can't fix all erectile dysfunction. So sex therapists are amazing. Resources for that, hermanandwallace.com to find a well-trained pelvic floor physical therapist. AASECT, American Association for Clinical Sex Therapists, something like that, asect.org. For license. It's rigorous to become a sex therapist. They don't just let anybody hang a shingle. Great resource for finding. And not all marriage and couples therapists are comfortable talking about sex, just like not all doctors are comfortable talking about sex. So really finding somebody who can help that conversation. Communication's huge.